Okay, so meet Monica. This will be Monica's 5th treatment with this Q-switch YAG, and her history is very interesting. She had a drug-induced subacute cutaneous lupus eruption on the chest, which presented with these thumbprint round patches and macules of pigmentation. Now, just by knowing the pathogenesis of what was going on with that, we know that the pigment would be deeper in the skin, not an epidermal pigment, but more of a junctional and in the dermal setting. So the Q-switch YAG would have been a great first guess. However, whenever we have a case like this, we will do a test site, and always a small site. And in fact, we tested 3 different pigment lasers on Monica before we ascertained that the superior laser was the Q-switch neodymium YAG. So then she had 2 full treatments a month apart, and then a year passed in between her 3rd and 4th. And at the follow-up on the 3rd treatment, she had maintained her improvement of this pigment. So we know that the Q-switch YAG was safe for Monica, and it had great efficacy. And today, we can barely see, I don't know if you can appreciate, I can appreciate still a little bit of sort of brownish gray pigmentation, and that's what I will be focusing on. And with the Q-switch YAG, I will be listening for the sound of where that pigment is that's responding mostly to the laser. Okay? Okay, so we're going to choose the settings. Now, with the Q-switch YAG, there are 7 choices of a tip diameter, which gives you great versatility. You can go from 2 millimeters up to 8 millimeters. 8 millimeters would give you the lowest fluence. I have the advantage of knowing what we've treated her with before and what works well. And in my practice, always, we never mess with success. So we're going to stay with the 5 millimeter handpiece, and that will give us a 2.25 joules per centimeter squared fluence. And so we will do, again, just sort of a painting, passing over the chest, and I will be focusing on the areas that clinically I can still see. And I will be choosing the repeat mode with a 5 hertz. So I am going to choose the 5 millimeter. There's our 2.25 joules. I am choosing repeat mode, and we will go, we have an option 1, 2, 3, 4, or 5. We're choosing 5. And so that will be our treatment setting. I'm making sure that I have the 5 millimeter tip on, just in case I forget. When I press ready, the laser will ask me to verify the selected tip. So it's just another inbuilt safety feature of the Lumenis system. So here we go. How'd that feel? Okay. And I'm barely even seeing any erythema. I know that it's safe to proceed. What we would be looking for are maybe petechiae, any kind of really dusky color, just something that might seem out of the ordinary. Everything is fine, and we're going to proceed. So here we go. And again, all that popping sound, Monica, is just interaction, sort of a photo-acoustical wave that's hitting that pigment. So that's a good sound. I know it sounds a little intense, but this is what we like to hear. And how are you feeling? Okay? Good. And how does this feel to you? Is it,
I just feel a little bit of warmth and maybe just like stinging, but it's
okay.
Almost immediately it's gone.
So a little bit of warmth, a little bit of stinging. If you set a scale of 1 to 10, what would you be feeling?
It almost feels like a minor, like a sunburn almost. Maybe 4.
Perfect. We're almost done. Okay. So what we've targeted were the residual melanosomes that are still in those macrophages, and we hope to further break those up and allow Monica's own beautiful system to dissolve them and absorb them away. We're finished.
Great.
Good.
Thank you.
Okay, so treatment is completed. What we can really see is just this background faint erythema, no real areas of petechia or bruising, but this is very reassuring. We know that we've had meaningful interaction of that laser beam and our targets, generating this gentle background, mild heat, mild redness. We're going to cool it down, as is usual when we're treating this kind of condition, and just this is just cold water, cold compresses, 5 minutes, maybe a little bit longer, but really just to calm down that reaction, give you a little bit of comfort. And then what you're going to do is put your broad spectrum sunscreen on, and there's very little to do for this in the aftermath. You just be careful with anything abrasive, any kind of clothing that might irritate the skin, or just anything with cleansing, any kind of abrasive rubbing, and don't use anything that will irritate the skin. And that's basically it. Okay?
Great.
Good. You're welcome.